Hi. My name is Kelly from Feel Good channel. In this channel I bring information that can make you feel good. Today I'm going to talk a little about diabetes differences. Type 1 diabetes, DM1, this form of diabetes is the result of the destruction of pancreatic beta cells by an immunological process, that is, by the formation of antibodies by the body itself against the beta cells, leading to insulin deficiency. In this case we can detect in blood tests the presence of these antibodies, which are ICA, IAAs, GAD and IA-2. They are present in about 85 to 90% of DM1 cases at the time of diagnosis. In general, it usually affects children and young adults, but it can be triggered in any age group. The most characteristic clinical picture is a relatively rapid onset, a few days to a few months, of symptoms such as excessive thirst, diuresis and hunger, significant weight loss, tiredness and weakness. If treatment is not carried out quickly, symptoms can progress to severe dehydration, drowsiness, vomiting, breathing difficulties and coma. This more serious condition is known as diabetic ketoacidosis and requires hospitalization for treatment. Type 2 diabetes, DM2, this form of diabetes includes the vast majority of cases, about 90% of diabetic patients. In these patients, insulin is produced by pancreatic beta cells, however, its action is hampered, characterizing a picture of insulin resistance. This will lead to an increase in insulin production to try to keep glucose at normal levels. When this is no longer possible, diabetes arises. The onset of the condition is slower and the symptoms, thirst, increased diuresis, leg pain, visual changes and others, may take several years to appear. If not recognized and treated in time, it can also progress to severe dehydration and coma. Unlike type 1 diabetes, there is generally an association with weight gain and obesity, affecting mainly adults over 50 years of age. However, the development of the condition is increasingly observed in young adults and even children. This is mainly due to the increased consumption of fats and carbohydrates combined with the lack of physical activity. Thus, the endocrinologist has, more than any other specialist, the chance of diagnosing diabetes in its initial phase, given the large number of patients who seek this professional for obesity problems. How to prevent diabetes? The best way to prevent diabetes and many other diseases is to incorporate healthy habits. Encouraging a healthy, balanced diet and physical activity should be a priority. Use of natural products can also help prevent blood sugar from rising. Beta beet, for example, has in its formula 8 clinically proven ingredients to support healthy blood sugar, increase your energy, stimulate your metabolism and assist in fat burning and weight loss. I'll leave the official website link in the first pinned comment so you can know. Buying beta beet with 90 or 180 days supply, in addition to saving money, you get free shipping. Beta beet comes with a full 60-day guarantee. You can try it and see its blood sugar restorative effects with absolutely no risk. If you are not totally and completely satisfied with the product or its results within the first 60 days, just contact support and they will refund 100% of your money. Remember, all information presented here is for informational purposes only. Consult a trusted doctor to receive proper guidance about your health status. If you are enjoying this content, please leave your like and comment. I really hope you feel good. Bye bye.